Good afternoon and welcome. My name is Alicia Torres. I'm the Director of Communications at Child Trends. And on behalf of the Family and Provider Teacher Relationship Quality Project, or FPTRQ, I'd like to welcome you to this webinar. The project offers unique tools for measuring the relationship between families and the providers and teachers who care for their small children. And as you know, these relationships are key factors in promoting positive outcomes for children and families. The FPTRQ project is funded by the Administration for Children and Families, Office of Head Start, and the Office of Planning, Research, and Evaluation. The project has been led by Westat and by Child Trends. Westat is a research organization that for more than 50 years has specialized in statistical design, data collection and management, and research analysis. Child Trends is a nonprofit research organization that for more than 35 years has produced and disseminated research, data, and analyses on programs, policies, and issues that impact the lives of children and their families. Throughout the webinar, if you have any technical questions, please submit them online. You will see a box at the right-hand side of your screen where you can easily submit questions to our team, and we will get back to you. This is also the same place where you can submit questions for the panelists. We will queue up the questions and present them to the panelists after the presentations have been completed. We estimate that we'll have about 15 minutes for Q&A. So today you'll hear from several panelists. You'll first hear some introductory remarks from Dr. Laura Hoard, social science researcher and analyst at the Office of Planning, Research, and Evaluation. She has served as the project manager of this program in this office. Then you will hear from our 4 researchers who have led and conducted the research and the development of these measures for this project. So in the order in which they will be speaking, you will first hear from Dr. Lina Guzman, a senior researcher and director at Child Trends with expertise in measurement development, among other areas. She has served as the co-PI for this project. You will then hear from Toni Porter, Early Care and Education Consulting. Formerly, she was a senior researcher at Bank Street College of Education. Toni's research focus has been in home-based child care, conceptualization and measurement of family-provider relationships in early care and education, as well as evaluations of ECE programs. Then you will hear from Dr. Manica Ramos. She's a research scientist at Child Trends and project manager for this project. Manica has her doctorate in applied developmental psychology, and specializes in research on early care and education programs, family engagement, and cultural sensitivity. She also brings to this project an expertise in survey development. Finally, you will hear from Dr. Kwang Kim. He is the project director of this project. Kwang is a senior study director at Westat, and he has research experience in survey research, early education research, and implementation of large-scale data collections and data analyses and reporting. He holds a doctorate in education research. I will now turn it over to Laura for her introductory remarks, and then Lina Guzman will kick off the presentation.
Thank you. Good morning, everyone, and welcome. We're very excited to be at this phase in this project, and I just wanted to let you know a little bit of background about how we got where we are. So family engagement has been a cornerstone for Head Start since its inception, and more recently it's become a focus across ECE programs, for example, with state QRIS systems seeking better ways of measuring family engagement, and with a focus on it with Race to the Top grantees. So 5 years ago, family engagement was beginning to gain attention and interest, and the OPRE, where I work, the Office of Planning, Research, and Evaluation, in collaboration with the Office of Head Start and the Office of Child Care, held a 2-day meeting of researchers, policymakers, program staff to really discuss what the next steps for the area of family engagement and early childhood education needed to be. And based on that meeting, the consensus was that what we really needed was a good measure of family engagement. It was also determined that not all programs had the same expectations for requirements of family engagement. However, good family-provider relationships were something that all programs really needed to build and were key to having good family engagement. Luckily for us at that time, the Office of Head Start had funds that they were interested in putting towards building better measures of the quality of early care and education programs. And seeing the need highlighted by the meeting for the better family engagement measures, OHS, Office of Head Start, and OPRE used the funds to create the FPTRQ project, which you'll hear about today. And it's important to note that the Office of Head Start was interested in broadly supporting the development of measures that could be used across ECE programs rather than just for Head Start. So that this, which you will hear about, the FPTRQ measure, is applicable within child care settings that are center-based, family, and Head Start centers. And I just wanted to mention someone that wasn't unfortunately able to be with us today, but Kiersten Beigel, someone that I work with in the Office of Head Start. She's the Family Engagement Lead within the Office of Head Start and serves as the Federal Project Officer for the National Center on Parent, Family, and Community Engagement, and she's had a very strong role in the development and work on this project. And I will hand it over. Thanks.
Thank you, Laura. And good morning, everyone. We're delighted to be here to be presenting to you the new Family and Provider-Teacher Relationship Quality Measure. The measures that you'll be hearing from us today are really the culmination of roughly 4 years of work. They were developed through a multi-step and iterative process, which you'll hear about in a minute, and we believe led to a rigorous and reliable measures. Let me just take a moment to run through what we'll cover today. We'll begin with an introduction to the project. Then we'll describe the development of the conceptual model that guided the development of the measures, as well as describe the various measures that we were developed. Kwang will then describe the pilot and field studies that were conducted, as well as the psychometric analysis that resulted from that data. We'll then discuss the uses of the measure, the development of specifically the measure of the Family Services Staff Measure for those in Head Start and Early Head Start programs, as well as the limitations and implications of the measures. Next slide, please. So as you've already heard, the project was carried out in partnership between Westat and Child Trends and was funded by the Administration for Children and Families, Office of Head Start, and OPRE. The purpose of the project was to develop measures that could be used by researchers, policymakers, and practitioners to assess the quality of family-provider relationships in early care and education settings. More specifically, a key goal was to develop measures that were applicable across diverse settings, including Head Start, and appropriate for use with racially, ethnically, and economically diverse populations. So to this end, we developed 5 separate measures depending on the respondent and target relationship. The first is a measure for providers and teachers about their relationship with their families. Second is a measure for parents about their relationship with their children's provider and teachers. The third is a measure for center directors about the features or environmental features of their programs. And fourth is a measure for family services staff about their relationships with the families that they work with. And last, a measure for parents about their relationship with their family services staff members. So why do we need a family provider-teacher relationship quality measures? Well, as you know, 60% of children, young children under the age of 5, spend time in early care and education settings. And these can lead to many positive outcomes, such as school readiness, increased family engagement, as well as strengthening the home-family program connection, which is an important contributor to child success. Yet, there's no single measure that incorporates all elements of provider-teacher relationship quality, such as knowledge, practice, and attitudes, which Toni will be talking about in a moment. There are a variety of measures that currently exist that assess different aspects of this relationship, though not all aspects. And many of the measures that are currently available are not necessarily applicable, were designed or tested with economically and racially diverse populations, nor are they available in Spanish. And we'll talk a lot about how some of the measures are available in Spanish. In short, there was a need for a new measure of family-provider relationships that could include all elements that the empirical literature suggests are associated with positive child, family, and provider-teacher outcomes. And this new and comprehensive measure fills a gap in the measurement field. It also informs programmatic and policy directions for measuring quality in family-provider relationships, as well as family engagement, and contributes to the knowledge base about the associations between specific elements of effective provider-teacher facilitation of strong relationships with families and the children and families they serve. So let's talk a little bit about how we went about developing the measures. As you can see, it was a multi-step stage process. It was also a very iterative process, and by that I mean if we found a bump in the road, we went back to the earlier steps and sort of examined, took another look to see what we could do alternatively. The first step was obviously to conduct an extensive literature review that led to the development of our conceptual model, which then guided our measurement development. We also conducted focus groups with parents, providers, and family services staff to confirm that our conceptual model captured the key elements of family-provider relationship quality. We also consulted with many experts, and we also did a very extensive item review, which led to the identification of items that we could use in the measures, or that we could either adapt, or as well as identify gaps in the measures where new items needed to be developed. We also did multiple rounds of cognitive testing to develop the parent and provider teacher surveys, as well as 2 rounds of cognitive interviews to develop the family services staff surveys. And those cognitive interviews were intended to assess the extent to which the questions were working as intended. We then conducted a pilot and field study in cities across the country and conducted psychometric analysis of the resulting data. As Monica will talk about in a minute, it's important to note that we did not start the project expecting to develop a survey for family services staff, but rather to use the provider-teacher surveys for them. However, as early as in the focus groups and later throughout, and as was confirmed in the later stages, we saw evidence that suggested that it would be best to develop separate surveys for family services staff. However, because of this, the family services staff that we developed, the family services staff surveys that we developed did not go through all stages of development. Notably, while they were cognitively tested, they were not piloted or field tested, nor were they, so as such, we don't have psychometric analysis to report on them. So for whom is the family provider-teacher relationship quality measures useful? They can be used by state and local administrators to inform the development or revisions of the quality rating and improvement systems, QRIS. It can also be used by state and local administrators to better align their professional development systems competencies. The measures can also be used by practitioners and professional development systems to identify or monitor the quality of relationships, as well as revise and focus and develop training and coursework to address areas of weakness or challenges. It can also be used to understand program progress and relationship building over time. And lastly, it could be used by researchers to test the associations between parent-teacher attitudes, knowledge, and practices, as well as specific child and family outcomes and impacts. And it can also serve as a reliable and comprehensive tool. And now I'm going to pass it over to Toni, who's going to describe the conceptual model that guided much of our work. Toni?
Thank you. Thank you, Lina. Good morning, everybody. To develop a conceptual model, as Lina indicated, we conducted an extensive review of the theoretical and empirical literature on family provider-teacher relationships from a variety of fields, including early care and education, K through 12, social work, mental health, and early intervention. In the model, we integrated common and unique elements from 3 broad perspectives on family provider-teacher relationships: family-centered care, parent involvement, family engagement, and family-sensitive caregiving. The common elements of these perspectives include an ecological view of child development, a focus on child outcomes through direct and indirect pathways, a focus on peer and social supports for adults as well as adult outcomes, a strength-based approach to relationships with families that focuses on families' unique resources and assets, and the centrality of family provider-teacher relationships. The unique elements from these perspectives include the importance of family capacity and empowerment, a focus on strong family partnerships and shared responsibility for children's learning, and an emphasis on the provider-teacher responsiveness and sensitivity to working families. So what you see in front of you is the conceptual model that we developed. As you can see from those two-way arrows, the model is bidirectional. That is, families may be more likely to become engaged and involved in their children's development and learning activities when they feel supported, understood, and empowered by programs and providers. And at the same time, providers and teachers may become more sensitive and responsive to the needs of families as parents become more involved and engaged in their program. This model is structured as a logic model in an effort to summarize a complex issue. Each construct has the potential to be dynamic, and there's no temporal assumption. Because the purpose of the FPTRQ measures are to inform assessment and monitoring of ECE programs, the central focus of the conceptual model is column 2, the effective provider facilitation of family-provider relationships. The elements in this column are the ones that the empirical literature suggests are associated with positive child, family, and provider outcomes. The elements, which I'll talk more about on the next slide, are grouped into 4 primary constructs. One is attitudes, which relates to providers and teachers' perceptions or beliefs related to their work with families. The second is knowledge, that is specific information that providers and teachers have about individual families they're serving. The third is practices, how providers' attitudes and knowledge are translated into their interactions with parents. And the fourth is environmental features, the tone, physical environment, organizational climate, and program level resources that foster strong provider, teacher, and family relationships. And as you can see with the asterisks at the bottom of the column, cultural responsiveness is assumed to cut across all of the constructs. The model also articulates factors that may influence family and provider-teacher relationships in column 1, and outcomes and effects, which are depicted in columns 3 and 4. Next slide, please. So here are the 4 primary FPTRQ constructs with their individual elements. You see that there are 4 attitudes elements. They include respect, commitment, which is sensitivity to the needs of children, parents, and families, and intrinsic motivation for work, openness to change, a willingness to alter normal practices in order to be sensitive to individual children, families, or parents, and a willingness to be flexible in varying practices based on this input, and understanding context, that is, having an appreciation for the broader context in which children's development and family lives are situated. Here's knowledge, which is that family-specific knowledge that I described earlier, and now practices, communication, responsiveness, which is defined as engaging in sensitive, flexible, and responsive support of families' identified needs and goals, including their work-family balance, collaboration, that is joint decision-making and goal-setting between the provider-teacher and the families, family-focused concern, communication that demonstrates interest in the family as a unit, and there's an additional element connecting to resources which is not depicted here. There are 5 environmental elements that are incorporated in the director survey, and they include welcoming, communication systems, culturally diverse materials, information about resources, and peer-to-peer parent activities. Lina?
Thank you, Toni. So now I'm going to be describing some of the measures that we developed. The first is the provider-teacher measure, which is intended for providers and teachers in early care and education settings, including center-based, family child care, and Head Start and early Head Start programs. I should note that because of the difficulty of entering the school districts, the measures were not tested specifically in public pre-K programs and classrooms. However, there's no reason to believe that the measures would not be applicable for pre-K settings. The questions ask teachers about how they work with the parents of the children in their care, It includes about 60 items and takes about 10 minutes to complete on average. And just to give you a sense of the types of items that we've included, we're going to be just providing a sample item for each of the measures. And one other thing that I should note is that whenever possible, we try to have parallel items across provider, teachers, and parents. So, for example, in the teacher survey, in the teacher measure, we have, since September, how often have you met with or talked to parents about goals parents have for their child? So in the parent measures, we would have a parallel item that also asked parents how often they have met with their teacher or provider to talk about the goals they have for their child. Next slide, please. So the second is the parent measure, which again is intended for parents of children between 0 and 5 who are in early care and education settings, and it asks parents about questions about how they work with their child's provider or teacher. The parent measure is available in both English and Spanish, and Kwang will talk later about the psychometric properties of both the English and Spanish version. It includes about 75 items and takes roughly 10 minutes again on average to complete. And a sample item that we have for the parent measure is how often does your child care provider or teacher work with you to develop strategies that you can use at home to support your child's learning and development? And as you'll see later on, you would see a parallel item of that in the teacher-provider survey. The director measure is intended for directors in center-based family child care programs. So, for example, the owner or the boss of the family child care provider program, as well as Head Start and Early Head Start program directors. It asks directors general questions about the education and care environment, as well as program policies. So it really focuses on the types of questions that teachers or providers may not have access to or may not be setting policies about. And it really focuses on sort of the contextual environment, features that really either set the tone or set the stage for developing provider-teacher relationship qualities. It includes a little over 50 items and, again, takes about 10 minutes to complete. And you may be wondering by now, why do the number of items vary so much, but yet the average completion time stays the same? For the director survey, it takes a little bit longer because they have to sometimes consult records or do math in their head. So they have to do a little bit more complicated recall and reporting than the teachers, providers, or the families do. So a sample item that we have in the director measure is, which of the following methods are used to communicate with families? Websites, email, etc. And now I'm going to turn it over to Manica, who's going to be talking about how we developed the Family Services Staff Measure and the work that we did for that.
Thank you. As Lina mentioned earlier, originally the provider-teacher measure was developed to be used with Head Start family service staff. However, we learned early on from focus groups and cognitive interviews that the provider-teacher measure items were not applicable to family service staff. Now, given the important role that the family service staff play within the Head Start mission, such as helping parents reach their own personal goals, supporting families by advocating for them, and connecting families to community services, we decided that we needed to develop separate, specific measures for family service staff. In addition to adapting provider-teacher measure items and developing new items where gaps existed, we also consulted the literature, interviewed with Kiersten Beigel from the Office of Head Start about family service staff roles and responsibilities, and conducted 2 iterative rounds of cognitive interviews. The Family Service Staff measure is intended to be used by Head Start and Early Head Start family service staff. It asks respondents questions about how they work with parents of children in Head Start and Early Head Start programs. It includes 113 items, 18 of which are demographics. It should take about 15 minutes to complete on average. And a sample item is, since September, how often have you been able to follow up with parents about goals they set for themselves? The Parent Family Service Staff measure is designed to be completed by parents reporting about their Head Start and Early Head Start family service staff. Now, please note that the family service staff is used when referring to the role in general, but when referring to a specific person in the measure, we use the term family service worker. The Parent Family Service Staff measure asks respondents questions about how they work with their family service staff. It includes 76 items, 10 of which are demographic, should take about 10 minutes to complete on average. And the sample item is, since September, how often have you met with or talked with your family service worker about how you are progressing towards goals you have set for yourself? We envision that the family service staff measures can be used concurrently with provider, teacher, and director measures. In order to gain the full perspective of the family service staff and parent relationship, we think it is best to administer both the family service staff and parent family service staff measures. Because the family service staff measures were not included in the pilot or field studies since they began their development about halfway through the project, these measures were not included in the psychometric testing. So for future work, we think it would be best to test questions in a study to establish reliability of the measures. Because the family service staff measures were not included in the field study, the items have not undergone psychometric analysis that will confirm construct assignment. Instead, we made recommendations for the family service staff construct assignments for all items based on conceptual model and parallelism with other measures. On this slide, you will see the number of items assigned to the family service staff measure, then the parent family service staff measure within parentheses. The constructs with asterisks denote the constructs that were not included in the parent family service staff measure. Now I'll return to Kwang, who will discuss field study recruitment.
Thank you, Monica. In spring 2014, earlier this year, we conducted a field study to collect data to examine psychometric properties of the FPTRQ measure. The first step we took was to send out pre-notice letters to programs informing them of the FPTRQ field study. We selected 6 cities across the country for the field study, and we contacted center-based programs, early Head Start programs, as well as family child care programs to make sure that we have diverse types of programs in our data. Then we called the program directors to get their permission to schedule a site visit, and we talked to the provider, teachers, and parents while during our visit. Working very closely with the director, we were able to recruit providers and parents, and we contact them face-to-face and hand out the measures for them to complete for us. As Lina and Toni mentioned earlier, the provider, teacher, and parent measure, we initially made the construct and subscale based on the conceptual model. But we want to make sure that the conceptual model that we come up with are still strong and stand strong. So we conduct the confirmatory factor analysis, and we found that our construct as well as the subscales were also supported by our result of the confirmatory factor analysis. Reliability test was the next step after we complete the field study. We used Cronbach alpha to measure internal consistency for each subscale, and the reliability estimate for most of the subscale of the FPTRQ measure were very strong, mostly 0.70 or higher. This slide, you will see the provider-teacher measure reliability estimates by program type. The first column for the 3 constructs, and the next column you will see 7 provider-teacher measures. And we present their center-based program, Head Start, Early Head Start programs, and family child care program reliability, and most of the reliability for subscales are very strong, and some of them are 0.90 or higher. But as you see there, the last line of attitude, the commitment subscale reliability show a little bit lower than other subscale scores. And we look at to see what's going on in those commitment subscale 4-item subscale scores. And what we found there was that the variation among responses were not much. So what happened was that many, but not all the provider teacher answers 3 or 4 to those 4 items. That's the agreed and strongly agreed. So it turns out that a lot of teachers, providers are very committed to their job. But not all of them actually, as I mentioned, answer the same way. Next slide shows reliability measure for parents measured by program type. Again, you will see 3 constructs and 8 subscales, and reliability estimates for center-based Head Start, Early Head Start, and family child care. Here, the parents measure subscale shows stronger reliability across each of the different program types, with most of the Cronbach alpha for over 0.90. The next slide, as Lina mentioned earlier, we have 2 language versions of the parents measure, English and Spanish. And this slide shows the reliability estimate for both English and Spanish versions of the parents measure. And the Cronbach alpha were over 90 for 6 of the 8 subscales here, as you see them. And it turned out to be very strong in their reliability estimates. Next slide, you will see director measure, and we did not group the items in the director measure into subscales. Instead, the items were mapped to environment construct in the conceptual model, as Toni mentioned earlier. It contains an environmental and policy checklist of yes/no items that can help to see how it provides some context for the parents and provider teacher measures. And we did not conduct the reliability test for the director measure because the items are all yes and no, and therefore it wasn't appropriate. Next slide, you will see how you can accessing the FPTRQ measures. The printable PDF versions of all measures can be downloaded at no cost from the OPRE website, and that's the website address, and we'll be posting this slide in the near future so you can get that information. You don't have to write down at this moment. And also Excel scoring sheet for the director, provider, teacher, and parents measure will be available on the same OPRE website. And most importantly, I think, FPTRQ measures user's manual will be available on the website as well. Next one is, before using the FPTRQ measures, I think you want to do a couple of preparations. First of all, of course, download the FPTRQ measures from the OPRE website and make hard copies so that you can hand out to your respondents. And meanwhile, I think, or before actually giving it out, you want to make sure that you will develop a systematic linked measure ID system so that, the director, provider, teachers, and parents within the same programs, same classrooms, are all linked together so that you will be able to find the findings from the measures and make sense out of it and making useful use of the information. The parents link and the link. Next one is the administering the FPTRQ measure. FPTRQ measures are developed so that it can be used in diverse programs and it can be administered very easily and conveniently. It is a self-administered measure, and we think that respondent name is not needed on the measures. Instead, it is good to use the ID system, numeric ID system. And I think it is important so that the respondent parents in particular, as well as teachers, providers, can really complete the measures honestly, so that because if they put their names, sometimes they feel uncomfortable sometimes, and it is also helpful if you give out the parents' measure to parents other than their own teachers or their providers. And at the same time, you can give to parents an envelope so that they can return their measures in a sealed envelope back to appropriate person. Next slide shows scoring the measures of the FPTRQ. As I mentioned earlier, Excel scoring sheet for director, provider, teacher, and parents measure will be available on the OPRE website. In the scoring sheet, you can enter respondents' answers into the spreadsheet directly, and then it will automatically calculate subscale scores for you. The FPTRQ measure responses can be also analyzed by using statistical package such as FPTRQ or SAS. And there are some reverse score items in the measures, and those information that the items are included in the user's manual for you to identify and make appropriate recoding so that your data will be accurate. Now I'd like to mention a few limitations of the FPTRQ measure. The field study was not nationally representative. As I mentioned, we selected 6 cities, but they were not nationally representative. And almost all early Head Start programs were run by community organizations, and small number of early Head Start programs are included in the field study. FPTRQ measure data not yet been examined with any outcome data, and so we do not have predictive validity analysis results to report. Also, no concurrent validity study of the FPTRQ measure been conducted yet, and as Manica reported earlier, due to difficulty measuring cultural sensitivity, it is measured indirectly across subscales. Next, Lina.
Thank you, Kwang. So let me just wrap up by giving you sort of an overview of the FPTRQ measures and what we think the new measures provide. First, together they provide, or they capture, provider-teacher perspectives across families and parents' perspectives on individual teachers. So let me back up for a moment and just clarify that the teacher measures ask questions about how teachers and providers work with families in their classrooms. So across all the families, how do they work with those families in general? So it's not intended to be a teacher report on a specific family. In contrast, the parent measure is about a specific teacher. And in fact, the parents are asked to report about the lead teachers. And we had a lot of discussion at the beginning of the project with our experts. And we opted for asking teachers about how they work with all the families because of the burden it would be to report on individual families or multiple families to get sort of a random representation. It was also unclear how many you would really need to get, how many families we would have to select in order to get good estimates. Secondly, the measures are applicable across centers, family child care, Head Start, and early Head Start programs. So the programs, the measures were designed specifically to be applicable across diverse settings. They were not designed only for Head Start or early Head Start programs. They're intended for all early care and education settings. Third, they're appropriate for diverse populations, including low and high income families, racially, ethnically diverse, as well as Spanish-speaking families. And they include multiple constructs, including attitudes, knowledge, practice, and environment. The key features that the empirical literature suggests are critical to the development or facilitation of family-provider relationship quality. And they're flexible to facilitate its use in either or part of a monitoring or evaluation process, as well as a research tool. And now, can you, next slide, please? And here we provide a couple of resources from our project, some measures, some documents that have already been released, as well as some products that come from the Office of Planning, Research, and Evaluation that predated the project, but that sort of helped to inform it as well. And so you know, we are going to be releasing not only the measures, but the user's manual and other documents, including a crosswalk between our measures or our conceptual model and others, a brief on cultural sensitivity, as well as other tools, and they'll be released later this year. Those who have registered for the webinar will automatically get an email when they're ready and released, and they will be available, and we will include not only a notice that they're available, but also links to the websites where they will appear. And you can find them later this year on both OPRE's website as well as Child Trends and Research Connections. And now I'm going to turn it over to Alicia, who is busy taking down all the great questions that we've been getting throughout the webinar and trying to organize them around the ones that are similar themes. So hopefully we'll have enough time to get through most, if not all of them.
Wonderful. Yes, we have about 15 minutes, and we do have a lot of questions that are coming in. One question that came in a while ago is, are parents asked to identify, well, you mentioned that already, right? You already, or are they asked to respond generally? Okay, that one has been answered. Let me move on to the next one. Are there any plans for Spanish version of the provider-teacher measure for family care homes who primarily speak Spanish? Monica.
So we specifically did not translate it into Spanish because in our sort of earlier work where we were doing the focus groups and the cognitive interviews, we found that for the most part, we weren't finding Spanish-dominant family child care providers. They were at least knowledgeable enough or fluent enough in English to be able to answer the measures in English. If we had found more Spanish-dominant or Spanish-only family child care providers, I think that we would have gone ahead and done the translation. That's not to say that this doesn't occur in certain segments of the country, but this wasn't it didn't rise to the top in terms of priority for translating and testing in Spanish.
Great, thank you, Lina. The next question is, did you conduct focus groups or interviews with parents or providers about how they filled out the measures, how they responded to see if they interpreted items the way you expected?
So the cognitive interviews were specifically designed to assess how parents interpreted the questions. So, for example, we asked them a question, and then we would say something like, walk me through how you went about answering that question, or what did that phrase mean to you? And we would also take notes if we were doing it in person. We tried to do, we did the cognitive interviews both in person and then over the phone. And the reason we did cognitive interviews over the phone was that we can get a much more diverse geographic sample, a geographically diverse sample. The ones that we did in person, we did take note to make sure that, we took verbal, nonverbal cues, as well as we made notes of, whether people were pausing or seemed hesitant, or we picked up anything that suggested that they were having trouble. And Kwang?
In addition, the FPTRQ measures don't have any skip patterns at all in the whole measures. So there wasn't any necessary any reason actually to test with how the respondent complete or make any mistake or any concerns like that at all. So we didn't do that type of testing at all.
Right. Yeah, because in terms of the responding and filling it out, it's a very sort of straightforward. Simple tool.
Right.
Okay. Next question: are there any differences in psychometrics based upon child age? Child age controlled for?
We did look at variety of, but we have most of the child, the parents of children age 3 to 5, and there are few younger age, and we did not see any differences among different age groups, parents of different age group actually, to make those things. But I do not have that information from me, but that is what we have learned, and so it worked on all the range, the parents with all range of children.
Great. Next question: what was the sample size that you piloted for the provider-teacher measure, parent, and director measures?
In the field study, we have 1,184 parents and 423 provider teachers and 253 directors from 3 different types of programs: center-based, Head Start, early Head Start, and family child care.
Have you looked at congruence between parent and teacher response within a given class?
During the field, I think Lina mentioned very briefly that there were some items that are common or same parallel between the parents and the provider-teacher measures. And initially, while we are developing the measures, we are hoping that there will be 100% congruence between two in their responses. But when we run the data, we found that they don't actually always agree between two. So it was actually what we realized was that the measure was developed for parents and provider teacher separately to get the full and comprehensive information for the quality relationship between them. So I think the data actually show that they don't always agree, so that it is very important to ask to parents as well as provider teacher separately, and that was kind of what we learned.
Great. The next question, I think, is perhaps Toni. Do you have a list of the family engagement models you used to develop the logic model?
We looked across a variety of fields for that. We looked at family-centered care models. We looked at parent, family, and parent engagement models, and we looked at the family-sensitive caregiving model. We looked specifically at those different approaches. In the forthcoming brief on the crosswalk, we've looked at the Head Start Parent, Family, and Community Engagement Framework, the Strengthening Families Framework, and the FPTRQ framework.
Great. Toni, so then I think there's another one here that maybe you would be the best person to respond to. How were teachers' desires for partnership with families included in focus group measures?
Included in the focus group measures. In the focus group, we asked both providers and teachers, and there were separate focus groups for both of those types of respondents, about their perceptions of what constitutes quality in relationships between families and provider teachers. So we elicited that first, and then we asked them to rank what they thought were the most important aspects of those relationships, and then we showed them the elements from the early conceptual model and asked them whether the extent to which they agreed or disagreed with those elements, the research-based elements. And for the most part, we found strong spontaneous responses to the elements that we had identified in the conceptual model even before we showed folks the conceptual model. And there were very few elements after we'd shown them the conceptual model with which there was some concern. Folks didn't really understand, for example, an original element that was defined as empowerment. They felt that it was sort of more disempowering than empowerment. And they also identified trust as a factor in those relationships, which we've incorporated in the elements.
The other thing that I would add is that both the parents and the providers and the teachers that we spoke with in the focus groups, as well as in the cognitive interviews, really saw the family-teacher-provider relationship as sort of defined through or centered around the child. That it was really in the, it was about the child, it was for the child. This was very much a relationship that wouldn't be existing without the child. So that our items really needed to reflect that.
Great. Manica, a question here for you. Do the surveys measure cultural sensitivity?
Now, given that cultural sensitivity can be conceptualized in various ways, we looked at what cultural sensitivity looks like specifically between the provider-teacher and the parent relationship. We found that cultural sensitivity can be measured as attitudes, knowledge, and practices, which are the same elements that characterize a quality relationship between provider, teachers, and parents. So ultimately, we concluded that cultural sensitivity is best measured through various elements and constructs rather than directly through items on its own subscale.
Okay, great. Thank you, Manica. For Kwang, have you looked at correlations between scales on the measure?
Yes, we did. I'm glad that you asked that question. We did look at correlation among subscales within parents measure as well as within provider-teacher measures. The correlations were higher within each construct, and they are not as high across, the subscales across different subscales and this construct. And the correlation are not like 0.4, 0.5 within same construct, and the 2 to 3 across the construct. And it actually, the one that actually we realized from the correlation analysis was that if there are a lot of correlation interaction among the subscales, and if you are making some changes in one subscale aspect of the relationship, then I think it will gonna have also effect on others. So I think the information that you'll be gathering from the FPTRQ will be really a good and useful tool to improve the family relationship quality in your programs and in the analysis, in the research that you will be planning to conduct.
Great. There are a lot of questions here, and we only have a couple more minutes. So I just wanted to say that we're not going to get to all the questions, and so what we will do is we will send emails to the people who have asked them with the questions later on. So we apologize, but maybe we should have scheduled this for a little bit longer. There's been a lot of questions coming in. There is one question here I'd like to address. Can the FPTRQ be adapted for electronic delivery or data collection? And who would I contact for discussions about permissions to make such adaptations?
It's not currently in that form that you probably is planning to use. So I think best person to contact is Laura, I think. Laura?
I'm here. So I would think that you could probably do it yourself.
Right.
I mean, just taking the measure as it is and transpose it into whatever system that you're using. But currently, that's not one of our goals to do that.
Right.
Okay, and for Toni, what aspects of family partnerships do the FPTRQ surveys capture that is not already in other surveys?
Well, because we're using the four main constructs, we're capturing all of the elements, as I indicated earlier, that the empirical literature suggests are associated with positive outcomes for children, families, and providers. And in particular, there are three different elements that are incorporated in this survey that are not necessarily captured in other measures, in these measures that are not captured in other measures. One is this notion of openness to change, which is not often captured in other measures because we think that there may be an assumption that that professional development falls outside of the family-provider relationship, the direct family-provider relationship. Another is this notion of specific information that the provider-teacher has about individual families. The measures are very comprehensive about the kinds of information that providers and teachers are expected to have about families, and go much farther than many other measures. In addition, there's in the environmental elements, there's a peer-to-peer parent networking, which is supported by evidence that social support for parents that may emanate from the relationship between the provider or the teacher and the parents is important for parental outcomes. That's often not included in other measures as well. And I'd also like to add that in terms of the practices elements, the FPTRQ measures are really comprehensive. They include the elements include collaboration, which may appear in other measures but may not be measured as extensively as they are in the FPTRQ measures. And the same thing goes for communication, which is far broader than what is often included in other measures.
And we have a minute left for an additional question. Thank you, Toni. And this is regarding whether there's a shorter version of any of the instruments to be made available. If so, were items identified for these versions?
The shorter versions of the parents and provider teacher surveys are currently under developed, and we will be make them available. But by I think in this fall when all the other measures and materials are available, and so that's where we are right now, and I think we are still working on it right now. So I think I probably won't want to say too much about it at this moment.
Great. Well, we've run just about a minute over. I want to really thank all of you for participating and all of the panelists. I know there's a lot of questions that have come in that have not been answered, but we will work on sending you responses to those. So thank you all, and until the next webinar.